Good afternoon and welcome everyone. My name is Robin Buxbaum. I'm the Strategic Partnerships Coordinator here at ACHA. This is our third ACHA COVID-19 weekly discussion. The first covered general COVID-19 information, and last week's session covered telehealth. If you were unable to make those, recordings of both of those sessions are available on our ACHA YouTube page. So several weeks ago, we asked you what topics you wanted help with during this crisis. Not surprisingly, mental health was a top concern. Now that we're settling into this new norm, mental health remains a big concern, not just among students, but also with faculty, staff, and providers. Today, ACHA is joined by representatives from Active Minds, the JED Foundation, and the Healthy Minds Network to help give you some useful information on how to guide your campus community through this emotionally challenging time. At any time, feel free to type a question into the questions pane on the right side of your screen. We have extended our time today by 15 minutes, so we will have time at the end for Q&A. One last item, those registered will receive a link to a recording of today's presentation, but as I mentioned before, it will also be posted on the ACHA website and on our YouTube channel. With that said, let's get going. I'm pleased to introduce our first speaker today. Joy Himmel has over 30 years experience in providing behavioral health care in a variety of settings. She is the former Health and Wellness Center Director at Penn State Altoona and past Counseling Center Director at Ross University School of Medicine in the West Indies. She is a fellow with the American College Health Association, has been a site surveyor for the Accreditation Association for Ambulatory Healthcare since 2009, and also serves on the board of directors there. And she also serves as an emeritus member of the ACHA COVID-19 Task Force. Joy is going to discuss the importance of mental health right now, as well as some of the challenges we're facing. Joy?
Okay, thank you very much, Robin, and thank you also to the task force who has put in a lot of time and energy related to keeping us all up to date and putting this panel together. So let me start by just kind of talking about some basic kind of foundation kinds of things. So I know that we are all living through really uncharted and challenging times. Acknowledging the reality is, I think, critical for us in terms of being able to adjust, but also to transition through this. So for all of us, life has been disrupted. There's many subgroups with increased vulnerability factors, but for our purposes today, we're going to focus on students, faculty, and staff, and caregivers. So a big topic related to a student's ability to bounce back in the face of adversity is the issue of resiliency. Now, this has been a hot topic, but now more than ever, it's a factor related to how one responds. So what's catastrophic to one is really just, I'll kind of roll with it, or I'll take it one day at a time to another. And we know that some students have a well-defined coping skill set and others not so much. Another key factor is that our students are in a transitional stage of life. So the meaning that is given or the interpretation to a disruptive event might be different for them based on that life stage. And then thirdly, we have, a global situation here with so much uncertainty. Those with underlying mental health issues become triggered. So we see this triggering with those with trauma backgrounds, those with depressive disorders, and clearly those with generalized anxiety disorder or panic. Switching to the unique vulnerabilities of our healthcare providers, there are many factors, and I'll just name a few, and other panelists are going to speak to this issue as well, but maintaining work-life balance. So, I think for many of us, we struggle anyway with this, but now you add increased demands of schools being closed, concern for family members, and our often overestimation of our responsibility to be all for all people, and you have the perfect storm. And then finally, we come to access to care issues. So providers are scrambling to figure out new ways of doing business. Students are struggling with figuring out what's open, what's not. And often those that need the mental health services the most are thinking, I don't want to be a bother. They really do have their hands full, and help-seeking behaviors can actually go down. or there is an uncomfortableness related to telehealth options in general. So they take the path of least resistance, which often is to avoid. So it appears to me that now more than ever, we need to be purposely reaching out to our students, friends, coworkers, and family. Next slide. So let's talk a bit about telemental health. And I know last Friday there was a webinar on telehealth, which had a lot of very valuable information, but some things that are currently in flux. And this issue is really about telehealth over state lines. And it is clearly a moving target. It differs per state and profession. And honestly, the best bet is to contact your state licensing board and check with your malpractice insurance carrier. The Federation of State Medical Boards is also a resource, especially for physicians. And in March, the 24th of March actually, the Secretary of Health and Human Services did put out a letter to all governors asking for licensing reciprocity. And the American Council of Education and over 15 undersigned organizations, including ACHA, also put out a letter to governors asking for licensing waivers and reciprocity. Another hot topic has been the relaxing of OCR standards related to HIPAA platforms. And again, college health centers who are not under HIPAA, but often FERPA, we know that state laws of confidentiality and privacy tend to prevail because they're much more stringent. So it still remains the best practice to use a HIPAA secure platform, and there are many free ones out there, and some of the EMRs even have this component as well. Some other things to keep in mind: make sure that your malpractice insurance includes telehealth. Ask for an addendum if it does not specifically articulate this. So as we are all scrambling to set up new systems of delivering care, some policies that are important related to telemental health include the following. Policies related to patient selection. Telehealth is not appropriate for all patients or all clients with a variety of different presentations. Informed consent. You want to make sure you have policies related to obtaining that and that the informed consent is specific to what you need. Security and privacy. Crisis procedures, probably the most important with telemental health. You want your providers to know exactly what to do if they have a patient who has suicidal ideation and they're indicating some plan or intent. And then the provision of care to minors, if that's provided, and then also documentation requirements. So what needs to be in that telemental health note? Next slide. Some of the elements that need to be included in an informed consent include things like limitations of privacy, restrictions on recording and posting. You certainly don't want your session uploaded on Snapchat or Facebook. And alternatives to telehealth should be also in there, and also benefits and threats and conditions to breach. So it's important to inform the client as to what their responsibilities are as well. And here we're talking mostly about equipment and space. So computer with a camera, adequate bandwidth, private location and space. And then what should be actually in your documentation on a telemental health note? Well, definitely you want to document that you received patient consent and that you answered any of the questions that the patient might have had. Type of connection should be documented. Is it synchronized audio-visual? Is it audio only? Also document if you're using a HIPAA secure platform or not. And then patient's location. If it's the same address as what's on file, then that should be indicated. And consent for anyone else who might be in the patient's private space or in your space. And then plan for a technology failure. Those things do happen. And then confirmation of emergency contact information, which again is very important with telehealth in general. Next slide. So some of the common underlying themes that I'm seeing focus on our collective perceived loss of control. Because we generally make plans, we assume what will happen. We have a pretense of control, although in reality we all know that plans often go awry. And the fact is that we live with uncertainty all of the time. I can expect to leave work today around 5 and be home perhaps by 5:30, but I might have a crisis patient at the end of the day. There might be construction on the way home. A bridge might be out. So, typically we're able to adjust when our reality doesn't line up with plans. But the pandemic is triggering our conscious awareness of really how little control we actually have over life events. So you want to figure things out so that you can control what you can. And so that might be developing a daily schedule, cleaning out a closet. I think my closets are probably as organized as they ever have been. But most importantly, really understand that the one thing you can always control is what attitude you choose. Another key issue is isolation. I'm seeing students in the grieving process. So grieving losses, internships, connections with friends, events, lost opportunities. Again, it's helpful to label it as such because we know a lot about the grieving process and its stages. I'm sure we have all encountered individuals in stages of disbelief, anger, depression, bargaining, but hopefully getting to acceptance. And then another key theme is fear due to sheer uncertainty. You know, anxiety is fear of the unknown, but the other part of it is that there's a belief that you won't be able to handle something or manage it. So again, to counteract that, really think about affirmations that focus on confidence and competence. One thing we know is that if you're irritable and anxious, it can be catching. Fear states can completely bypass the frontal cortex, go right to the limbic system, which promotes irrational behaviors like buying up all the toilet paper and negative mood states. So some strategies: continually right-size anxiety. We're all going to have some level of it, but you want to get it into perspective by doing things like catching the catastrophic, fortune-telling, doom and gloom type thoughts and reframe. There are other things listed here, but probably the most important thing that it's very important to do is get out of your head and purposely help people to understand that they need to reach out to others. It's very difficult to stay in your head if you're helping someone else. Next slide. A few other helping suggestions are listed on the slide. In addition to helping our students, they also obviously apply to us as caregivers. But, you know, I usually work with students to maintain a daily schedule, set daily goals, check off tasks. It's so important to go to bed at the same time, get up at the same time, get out of your pajamas, get out of your sweats. I usually tell them, dress for the social life that you want. And, you know, everyone has to find their control-alt-delete type activities. So that might be developing a mantra, a meditation, taking 5 minutes to do diaphragmatic type breathing, coloring, journaling, etc. So the last one that I'll mention is really scheduling worry time. And as silly as this sounds, it works quite well, especially for those with underlying anxiety disorders. So every time you catch yourself in a worry cycle, you shut it down and remind yourself that you don't need to do this now. You have a time and place for that. And when that 20-minute time frame comes in your day, that's all you do. There actually is an extinction process with this. So with flooding in a concentrated time frame, which has been proven to be very helpful in extinguishing the need to worry. And with that, I think I'll hand it back over to Robin and then Nell.
Great, thank you, Joy. Next, I'd like to introduce Nell Davidson. Nell served as the Director of the Health Service at Case Western Reserve for 30 years. Since her retirement from that position, she went on to get her master's degree in bioethics at Case Western Reserve and now serves on the adjunct faculty there. Dr. Davidson also serves as an emeritus member of the ACHA COVID-19 task force, and she is going to discuss the mental health challenges facing our providers, staff, and faculty members. No?
Thanks, Robin. And lovely to be with all of you. I was hoping to see you in May at ACHA, but hope to see you in the future. So how do I think of this? Back in the time when we were thinking that the H1N1 pandemic might in fact be this type of event, we were looking around for prototypes to make sure that we honed our plans properly. And so we were looking at the SARS outbreak in Toronto back in 2003 for hints of lessons learned. And the big thing that struck me at that time in Toronto was how many clinicians, nurses, all the very different kinds of clinicians working in the hospital, had symptoms that were consistent with post-traumatic stress disorder. Now, there have been longer term studies now looking at these individuals, and they've largely done quite well, but they suffered a great deal during the outbreak. And it's always been in my consciousness that we need to take care of our caregivers. Since I'm a bioethics person now, I think of this in that way too. So we have an ethical duty to prepare for and to deliver care to our caregivers. And we cannot dispense this duty by a list of self-care activities. Clinicians often are used to working on their own and suffering through quite a lot, but I am here to say, take advantage of people around you who can help you. This is a time to reach out and ask for help. Care given to caregivers is what we owe you. It multiplies exponentially in the care you give to others. And I'd in fact argue that the less we're able to take care of ourselves, slowly over time, the less we're able to give to others. So it's very important that we do reach out and make use of these resources. In Toronto, caregivers with families appeared to have somewhat more problems because you had split loyalties and you were thinking of so many people, and that now it sometimes can be parents who are old enough to be of concern and your kids at home. So we need to be mindful of these important partners. Next slide. So what we know anxiety is appropriate right now. If you're not feeling anxious about something, it's, maybe you don't understand the situation. But as Joy said, and I completely agree with this needs to stay in a manageable amount of anxiety. We want to moderate the amount of anxiety we experience at any time and take it in manageable doses. We can't get rid of it entirely. We can't be so calm and do whatever self-management tools are that we never approach it. That really doesn't work well either. We need to keep approaching it, desensitizing ourselves to the anxiety so that we can tolerate living in it. But different people will use different activities that help moderate the anxiety. Joy talked, some of us clean a lot, serves a good purpose. I've taken to watching certain kinds of movies with good themes where they turn out okay at the end. We all have different things that work for us, but one thing is we can't avoid it altogether. So it's kind of like allergy shots. We build this up in manageable doses. Next slide. So my favorite general self-management tool for everyone is a 20-minute walk outdoors. For clinicians, in the middle of your day when the sun is shining, it's nice to take those 20 minutes outdoors. And this one doesn't work if you take your phone and then transact a bunch of business on your phone while you're out walking. So this is walking on your own, letting your thoughts clear and improve your function. I always, with patients as well as colleagues, try to talk about watching the amount of caffeine you take in. Sometimes when people become irritable, and this was something I had to learn early on with patients, anxiety presents more as irritability and anger, and you just become angry with everyone and everything around you. Caffeine kind of adds to that. So that's something to keep aware of. I added this, get enough sleep. Remember Matthew Walker, who has written a number of wonderful things about sleep advice. You may not want to read his book now, but there are YouTube clips on how to improve your sleep that are very, very helpful in only 20 minutes. For all of us, I think it's good to watch your alcohol intake. People that are having trouble sleeping sometimes discover that alcohol seems to help them get to sleep. But as I used to always talk with patients about this, it tends to then wake you up an hour or 2 hours later and then totally disrupt your sleep cycle. So it really is not a very effective way of dealing with the need for sleep. I would add along with this avoidance of benzodiazepines, which people sometimes use as an as-needed basis for anxiety. I didn't add this to the slide, but it's something to think about. Again, I always would say this to patients. We don't use the as-needed benzodiazepines because they have such a tendency to become habit-forming. That is not to say that there are not other medications that work quite well. So I think in this category of the SSRIs and the SNRIs, both of which taken on a daily basis, do work for anxiety. Now, we don't tend to think of using those when largely the anxiety is provoked by situations. But this is a time when use one of your resources to reach out and talk to a professional about that and see what your exact situation is without prejudging that. So that's just a sidebar with that. Joy, again, talked about using language that's accurate but doesn't catastrophize. If you listen to the news much today, you hear people talking about horrible things and unmanageable things and overwhelming things. It helps for me to take that all back down a notch. Talk about something accurately, but not with catastrophic language. And include positive self-talk. The Institute for Healthcare Improvement recently presented a checklist for clinicians leaving the hospital that's being used in England. And this checklist included things like take a moment to think about today, acknowledge one thing that was difficult on your shift and let it go. Be proud of the care you gave today. Consider 3 things that went well. Check on your colleagues before you leave. Are they okay? Are you okay? Your team is here to listen and support you. And then the last thing was now switch your attention to home, rest, and recharge. Next slide. One of the sites with advice during this particular outbreak for clinicians advised identifying a buddy. That can often be a colleague. It could be somebody in your environment around you who's not exactly in your workspace. It could be, you might want to think of using the emeritus members of the COVID-19 task force for this. You could use somebody in your institution who has recently retired but knows what your tasks are. We can't do this alone. Even when we understand self-care well, we may forget it. It's okay to say to your buddy, I'm feeling overwhelmed. Could you listen to me for a bit? I don't feel like I've got all the answers. And again, sometimes, often hospitals now are offering mental health resources for people as well. My daughter-in-law, who works at a fabulous hospital in Boston, gets texts daily from the hospital with numbers about how many cases there are in Boston and various other things like that. But that message starts this way: your mental health and emotional well-being matter. There are many ways this crisis might affect your mental health and emotional well-being. There is no need to worry alone. Support is available. So I would just encourage you, when you see those resources, write them down and think about using them. Next slide. Again, I talked about this, consulting with colleagues. You could use the emeritus members of the COVID-19 task force. For those who are leaders, make good enough decisions today. Don't spend all your time thinking about the perfect decision. The evidence may change tomorrow. Make a good enough decision and move ahead. Don't get stuck in regret. Learn from any mistakes and move ahead. Next slide. This I like to keep up on my bulletin board about perseverance. So remember, we're in this for the long haul, and perseverance is not one long race. It is many short races, one after another, meaning we need to pace ourselves. Next slide. So I'd say we've got this. We already have a framework. There's so many people in college health that have worked so long on pandemic preparedness. We know about outbreaks of respiratory illness. We know about other kinds of outbreaks. We live with students who live in close quarters. The cruise ship things weren't a surprise to us. We know the basics, and together, working through this, we'll invent what we need to. You've got plenty of support from the people who've done this. And also, one of the things I very much appreciated about college health as I moved outside of it was how well people work collaboratively from an interdisciplinary perspective. And that's an enormous strength. Next slide. For faculty and staff, thanks to David Anderson for some suggestions. Many of those other tools and techniques will work for them. All of us are taking on new and unexpected roles. Faculty teaching online have a huge challenge. It takes time and support to adjust and thrive in this new environment. Look for good sources of evidence-based information, including CDC and ACHA. Next slide. Next slide. And we always had a message like this when we were doing the JED campus program. I put this frequently in. Remember, we're all in this together. Help is always available. If you're feeling alone and struggling, you can reach out to the crisis text line or to the National Suicide Prevention Lifeline. Thanks so much.
Thank you. Nell, I'm sorry about some of the hiccups with the slides. So next up, I'd like to introduce Becky Thein. Becky is the Director of Training and Engagement with Active Minds, one of the nation's leading nonprofits for young adult mental health advocacy and suicide prevention. She's been working in the field of mental health advocacy among young adults for the past 9 years, 5 of which have been with Active Minds. Her focus in college health has been identifying mental health concerns of students seen in the primary care setting with the goal of increasing access to evidence-based care. And Becky will talk to us a little more about the student mental health experience right now.
Hi, yeah, thanks so much for having us on the call today. So just a quick bit about Active Minds for folks who don't know about that. If we could progress to the next slide. Active Minds is one of the nation's premier nonprofit organizations supporting the mental health awareness and education for students. Our peer-powered approach is one that has been evidence-based. We engaged in a study with the RAND Corporation that really demonstrates that this unique peer-powered approach is changing the way students think about mental health, the way that they treat each other, and the way they talk to each other about mental health, and the way that they access services when they need it. Active Minds has been around for about 16 years now, and as of this year, we have a presence on more than 800 campuses through our signature programs, and about 600 campus-based chapters. So I want to focus this time on talking a little bit about what we've been doing in response to the COVID-19 crisis and outbreak, and this very, very dramatic shift in students' realities away from on-campus life and classes and towards a home-based remote learning situation, and in many cases separation from their social networks on campus, and in some cases, in the case of the class of 2020, experiencing very severe disappointment around not being able to graduate in the way that they've always imagined, and those pieces that are coming along with this pandemic. So in response, one of the primary focuses Active Minds has had has been in creating opportunities for live content and live virtual engagement for our students and for our general population. We've been working on creating content around self-care and sleep hygiene and anxiety and communication while in quarantine. So a lot of different offerings. We've also opened up a space for what we're calling weekly student chats. And so that's an opportunity for students to connect with each other about how to be mobilizing around the pandemic as student organizations that are focused on mental health. One thing that I've been very, very struck by with regard to staying in close touch with our Active Minds student leaders throughout the country is that I'm seeing young adults step up to the plate in such an admirable and creative, innovative way. We're seeing our Active Minds chapters really self-identify as key players in the resilience and coping of their peers right now. They see their message as so important right now, and we're seeing such creativity in how they're delivering that message. So we're seeing a lot of online virtual engagement among chapters of Active Minds, programming among chapters of Active Minds that include how to talk with each other, how to take care of themselves and each other in this time, how to stay connected. There's a lot of discussion around, for example, instead of referring to it as social distancing, which is kind of the term that's very ubiquitous right now and is the public health recommendation, we talk about physical distancing. So we see students really addressing that, say, let's stay socially connected. Let's not distance socially. Let's just remain physically distanced. Indeed, let's up our social connection and communication with one another. So I wanted to highlight a few things that we're hearing from students, to everyone on this call who has an opportunity to embrace their platforms and their expertise to get really great information out there. The resounding themes we're hearing from young adults who are struggling with how to think about this and what to do. And actually, if we could progress the slide, Robin, just to the main message, which is we're hearing from students that they're craving messages of community. We're in this together. You're not alone. And I'm happy to kind of piggyback off of Nell's message, just preceding mine here, which is that we've got this, and we don't really know all the answers yet, but here's where you can get the most accurate information. We're hearing students say that they're not sure how to parse out all the information that's coming their way, and if we as the experts in the field can support them in navigating the news and the messaging and the recommendations, they'd really appreciate seeing that through platforms that they already have a trusted relationship with, like Active Minds, like ACHA and JED and Healthy Minds, and all the folks that are on this call, and the people who are in the audience here. I think, certainly their campuses and administrators. So accurate information being a really key piece that young adults are craving right now. And validation. This is another thing we're seeing a lot of. At Active Minds, we have a tool we call VAR, which is validate, appreciate, and refer. So we're seeing this, with very slight adaptations, be very applicable right now. So what that means is it's a communication tool, an everyday tool for everyday conversations, which starts with validate our feelings. If someone says, I'm really struggling, I'm really overwhelmed, or I'm really confused with everything that's happening right now, start by saying, I hear you, that makes sense. Yeah, things are really overwhelming right now, and it's okay that you're experiencing some confusion around this. We're seeing that a lot. We had a young adult write a blog post for our Active Minds blog today that talked about how disappointed he is to not be able to graduate in the way that he'd imagined. And the message he's been getting a lot of is, well, at least at least you're safe and healthy, and at least other things. And he's saying how invalidating that can be. And it's true, there's a lot to be, it can be easy to fall into comparison and minimizing our own experiences around what we're going through. So starting with validation and appreciation. I'm really glad you shared, especially right now while we're in these closed quarters and everybody's kind of in living situations that's atypical to them. Appreciates. I'm glad you spoke out. I'm glad you shared. Communication and keeping these doors open is the best way we're going to get through this. And again, like Nell said before me, asking when we need to be heard is really an important step there, using our tools to validate what other people are sharing, and also speaking out when we need to be heard, when we feel like we need to express something that we're going through. So hey, do you have a minute I can share something that's on my mind right now? It is an important tool. So I wanted if we could go to the next slide. And we have a lot of really great content coming up, but I wanted to take a minute to share with you all what we're hearing from students, which again, to kind of recap, is validation. We're hearing students really are craving that validation and guidance and accurate information from trusted resources, and a message of we've got this, we're in this together, you're not alone, it's okay to be confused or frustrated or challenged or disappointed by all of this. It's very overwhelming what's happening right now. If anybody wants to chat more about the kind of online and virtual engagement we're doing, I'd be very happy to connect with you individually. You've got my email address up on the screen right now. And thanks so much. We'll pass it on to a colleague.
Great. Thanks so much, Becky. That was really helpful. Our next speaker is Nance Roy. Nance serves as the Chief Clinical Officer of the JED Foundation and is an Assistant Clinical Professor at the Yale School of Medicine, Department of Psychiatry. She has over 20 years of experience as a psychologist working in college mental health. Through her work with the JED Foundation, Dr. Roy has worked on mental health initiatives with the former Surgeon General, the Higher Education Mental Health Alliance, the Department of Defense, the VA, the Clinton Health Matters Initiative, and college and university systems across the country. And Nance is going to talk to us about the JED framework and using it to address mental health from a systems perspective. Nance?
Thank you. And thanks for having me, and thanks everyone for joining us online. Be great if we could see everyone's faces, but I think that would be technologically challenging. So we'll do the best we can. And I'll just take a minute first to tell you just few things about JED, in case you're not familiar with the JED Foundation. JED Foundation was started 20 years ago, actually. This is our 20th year. It's a milestone for the JED Foundation. We would have been celebrating with our 20th gala in June, but that is on hold, unfortunately. But in any event, 20 years ago, Donna and Phil Satow, who started the foundation, their son Judd died by suicide when he was in college. And when they went to his university, I believe it was Arizona State or University of Arizona, the administrators that they met with to try and figure out, what happened here, they said to the Satows very earnestly, what would you have us do? We're a school of 20,000 students. Like, how would we know what should we be doing? And so Donna and Phil came back from those meetings and processing the death of their son and started the foundation to really promote the work on college campuses around suicide prevention. They quickly learned that really, if we want to move the needle on suicide prevention, we need to be thinking about promoting positive mental health. And so the foundation's mission, although ultimately is to reduce suicide, has really focused on promoting well-being among our teens and young adults. Next slide. So one of the ways we do that is to work with colleges and universities and soon high schools across the country in implementing our comprehensive framework for promoting emotional well-being. For those of you who have been on our website, I'm sure you're very familiar with the, I'm sorry, I clicked something on my screen, with the graphic depiction of our framework, which is in the form of this wheel. I should say that the framework is an evidence-based framework. It's really the only one we know of in terms of a comprehensive systems approach to reducing suicide. And it was developed by the Air Force about 20 years ago, perhaps just slightly more than that. And they demonstrated not only when this model was implemented systematically and in a continuous way, they demonstrated significant reduction not only in suicide among the military, but also domestic violence and substance abuse. And so we took that model and adopted it for use with teens and young adults. If we had many other hours, I could talk about why we're continuing to see the rise in suicides among the military, which is mind-boggling to me, since they're the ones that actually were the first to demonstrate efficacy with this model. The dilemma being that it is not systematically and consistently implemented, which again is another presentation for another day. But that is where the model came from, and that is this is how we've adopted it. So the two really underlying principles of the model are that the responsibility for promoting mental health among our youth can no longer be left to health and counseling centers, which traditionally it has been, especially in our schools and on our campuses. And rather that the responsibility for promoting and supporting mental health among our students must be a campus-wide responsibility, with everyone having a role to play. And by that we mean athletic trainers, coaches, security, facilities, academic advisors, your usual student affairs suspects, dean, VP, president, I mean, you name it, across the board, academic advisors, faculty, students. And secondly, that you need to have support from senior leadership. And we found in working with systems across the country that unless those two principles are in place, you really won't be effective in sustaining any kind of long-term change. So that's the sort of foundations of the model. You know, in preparing for the talk today, you know, it was mentioned that the model, even though we use it primarily with systems, in our work with schools and soon high schools, the model is really quite applicable to what we're experiencing today in the pandemic. So I'm going to talk about how the model applies very briefly from each of the domains. Next. So the first domain in the comprehensive framework is helping students to develop life skills. And so we have found when we work with schools that so many, and I think it was Joy that mentioned this early on, so many schools, you know, folks at school are telling us that they're finding that students are coming to campus far less resilient than they have in the past. And so when we work with schools around how to develop life skills, it certainly is easily transferable to what we're doing what we can be doing right now with students at home. And, you know, we've been doing some webinars for families, for parents, and for students on what they can be doing. And so around life skills, I mean, what better time to be developing life skills? You know, simple things like learning how to cook, learning how to do the laundry, things that schools are finding students very ill-equipped to do, even basic tasks like that. Certainly things like, you know, how to communicate effectively, dealing with interpersonal relationships, developing interpersonal relationship skills, dealing with conflict. You know, I can't imagine I can't imagine that there's a family in the US that isn't dealing with some kind of interpersonal relationship struggles or conflict in the home, with all of us sort of living together unexpectedly and nonstop. So thinking about how to talk with our young people around how to communicate effectively and how to manage difficulties with others, especially now that we're all sort of cooped up together. Other things that also I believe Joy and others have mentioned is, you know, helping students with time management with our young people at home. What better way to help them really reinforce the need for a routine? I was reading, or it was on a webinar or something that came across my desk about working from home. And the number one tip was put on pants, real pants, which I thought was kind of funny, but actually quite true. So as Joy, I think, mentioned, you know, teaching students and our young people, getting up at a regular time, getting dressed, showering, spending some time with school, spending some time relaxing. These are all skills that are going to help them tremendously when and if they do go back to their campuses or their high schools. Next, around promoting connectedness, we know that, especially for first years, loneliness is the single largest struggle that they report. And so thinking about being home now, isolated from friends, and Becky certainly did a good job of talking about this and how peers are so essential at this point in time. And so how are we continuing to promote and provide opportunities for connectedness among our young people? So of course, online platforms are the way to go right now. Skyping, all the other modalities that I'm sure I'm not up to speed on, group chats, many schools. I was looking at the ACHA listserv the other day, and so many great resources being posted on what schools are doing digitally for health promotion online, workshops, groups, etc. Thinking about family activities. Someone sent around this morning, I don't know if you all saw it, but a family that put their own lyrics to Les Miserables, one of the songs in Les Miserables, which was hysterical, but ways to think about whether it's playing board games or reading together or some kind of family activity to promote connectedness along with the digital platforms that folks now have access to. Next. So identifying students at risk, I like to think about this more as identifying students who might be struggling, because we certainly don't want to wait until someone is at risk before we recognize signs of trouble or distress. So especially now when students are at home, really honing in on, especially on social media platforms, really paying attention to language. And semantics, since we don't have, unless you're on a visual platform, a video platform, we don't have the luxury of actually seeing someone in person to note their affect. So really paying close attention to what people are saying, listening really attentively. When, as someone also earlier mentioned, we all know that a certain amount of anxiety is normal right now. In fact, if we have no anxiety at all, it's probably more worrisome, right? And so helping to both normalize anxiety that students may be feeling, but also to be paying attention to when that goes beyond the bounds of what we might consider a normal reaction to our current situation. Again, what was mentioned earlier is grieving. So many of our students our young people have lost not only traditions and ceremonies that are quite meaningful, like graduations or proms or things of that nature, but really have been, torn away from their campuses quite abruptly. Sudden shifts, not only to online learning, but to isolation from what has become their holding environment. So again, paying attention and reinforcing the normalcy of grieving, but again, looking for signs that might be troublesome, like excessive isolation. If your young person is never coming out of the bedroom, for example, or if they're never going to the online class that you're offering, or they're not engaging in any of the online platforms that you're offering, certainly, might be worth reaching out to that person. As well, changes in appearance, appetite, mood, things of that nature. At home, we certainly want to be asking our young people, if we're noticing something, to really clearly say, gee, I've noticed X, and be specific. Engage them in a conversation and be role models ourselves about, and this sort of translates into the next section on help seeking, about acknowledging that we too are anxious, we too are grieving certain things, and that hopefully as role models, we are not hesitating to reach out for help ourselves. So encouraging conversations about getting help, normalizing, a certain level of anxiety, depression, and grief, but certainly letting our young people know that, these are tough times and all of us probably can benefit from some support. Some may need more than others, as was mentioned earlier, but certainly encouraging conversations, and through those conversations, understanding when a young person may need professional help. The Active Minds presentation on peer support, and can't say enough about that. We know that students turn to each other before they go to anybody else for support when they're struggling. So again, opportunities for students to connect together is key. And then certainly it's important to know area resources. So, our students aren't on our campus right now. And so if we're talking with a student, what are the resources in their area? Are they currently seeing a therapist? And if so, do we have the contact information? This is especially important for families right now, to have this information at their fingertips and to encourage outreach or to reach out themselves if they're worried about their young person. Next. Crisis response, certainly. Hopefully we're not, we don't see a lot of crisis in terms of mental health, but I think that might be wishful thinking on my part. So certainly having this information at your fingertips. Obviously 911 isn't easy. Everyone knows about that, but thinking about encouraging our youth to use crisis text line. They have had an explosion in the number of texts they're getting since this has all transpired. Lifeline hasn't had a tremendous increase in their calls, but that is yet to be seen. I'm sure that will change over time. Domestic violence, and it is something that unfortunately we need to also be mindful of, the potential for increasing, whether it's child abuse or spousal or partner abuse. So knowing where the area resources are for help, having naloxone available if you have someone that or, especially in close proximity, who may be struggling with an opiate addiction. So having those resources at your fingertips. And then lastly, means restriction. And this one worries me a great deal, actually, as we are, confined to our homes. For those homes that do have firearms, and I'm sure you've also been reading about gun sales doubling or tripling in the past month, several weeks or month. Making sure that if you do have any type of weapons or firearms in the home, that they're stored securely, that they're locked, that ammunition is stored separately from the weapon. All of the safety regulations that we all should be practicing every day, but especially now when tensions run high, and people are easily frustrated, and at their wits' end. And also not to forget about medications that are in the home, making sure that they're secured. Are they in locked cabinets? Are they out of reach of young people, or any of us really, but especially our young people? Next, I think that might be it. Yeah, that's it for me. So again, as Becky had mentioned, I'm happy to talk further about the framework or our work across the countries with schools, colleges, universities, and as I mentioned, soon to be in high schools. So if anyone would like to talk further, please don't hesitate to reach out.
Thank you so much, Nance. Last, but certainly not least, we have two representatives from the Healthy Minds Network. Daniel Eisenberg is a professor in the School of Public Health at the University of Michigan. His research brings a population level and economic perspective to youth mental health with an overall goal of understanding the best opportunities to invest in young people's mental health. He directs the Healthy Minds Network, an annual survey of college student mental health and related factors, along with Sarah Ketchen Lipson. Sarah Ketchen Lipson is an assistant professor in the Department of Health Law Policy and Management at the Boston University School of Public Health and co-principal investigator of the National Healthy Mind Study. Her research focuses on understanding and addressing mental health and inequalities therein that exist on college campuses. So Daniel, thank you.
Yeah, hi everyone. I hope everyone's doing okay out there, and it's nice to connect even though we can't see each other. It's nice to connect online. So we're going to just talk very briefly about some of the data that we're planning to collect to help understand how students are doing. And we'll go very quickly because we want to make sure there's time for questions and comments at the end. Next slide, please. So we'll just say a bit about the Healthy Mind study, a survey study where we've been collecting a lot of student mental health data, some of the new data related to the pandemic that we're planning to collect. And Sarah's also going to say a bit about the role of faculty and some new data for that. So next slide. So our Healthy Mind survey study is a web-based survey study. It's been going for many years now. It's included a large number of campuses and student respondents. With a nice team based at Michigan and Boston University listed on the right. But you'll have all these slides to look at your leisure. So next slide. Actually, we'll keep going along. So the Healthy Mind study covers a wide range of topics, and the way that we do it is we have a modular format where there's a few core sections which are listed in the middle here, and then a large number of elective module sections that campuses can choose, typically 2 of them, to round out the survey. And so next slide. So now we're thinking about what kinds of questions, survey questions would be most useful to ask students related to the pandemic. Next slide. And so in general, we don't want to necessarily duplicate all the other surveys that are out there in the general population. So we really want to focus more on what are students' unique experiences with the pandemic and in relation to their campuses. And so the topics that we're planning to, what we're going to do at a small number of schools that are still going to field the survey in the coming weeks is to ask a set of questions, 10 to 15 questions, just to get a sense of how they're doing, and then look at how it relates to mental health. And then in the fall, we'll expand to a larger set of questions, most likely to get a fuller sense of how students are experiencing this situation. So some of the main topics that we'll be covering are students' personal and direct experiences, like whether they've contracted the virus and how severe their symptoms were, whether they've been affected financially or economically, have they lost a job, for example, have they had to move, what kinds of preventive behaviors are they taking with their hygiene and distancing, what are their main fears about the situation, how supportive do they feel like their campus has been, and also whether they're experiencing discrimination. Particularly, we're concerned about Asian and Asian American students in that regard. Next slide. So I'll turn it over to my colleague, Sarah.
Great. So we've been thinking a lot about opportunities for partnership and ways that we can be continuing to strengthen the field of folks who are working on addressing mental health on college campuses. We have an ongoing randomized control trial study called IAIM-EDU, which is a study of a digital mental health therapy app. It's based on cognitive behavioral therapy for college populations. And we just wanted to promote the opportunity quickly here that we're enrolling schools for next academic year. Obviously, this is a time when we're all really thinking about opportunities through mobile mental health resources. And this is a study that we care a lot about. And there's more information on it right there. Next slide, please. Another thing that we're thinking a lot about is the role of faculty in response to student mental health, always and in particular during campus closures. So faculty represent a really key gatekeeper on campus in order to be able to recognize students in distress. There's obviously a really important connection between mental and emotional health and students' academic performance. And faculty are in this unique position to recognize students in distress. And faculty are also a really important relationship for students in terms of their overall college experience and retention and a bunch of other different outcomes. Despite this, very little is known about the experiences of faculty responding to student mental health concerns and the role of faculty as gatekeepers, their knowledge, perceptions, attitudes, priorities, openness to training, the resources that they need. And so we're developing a new national survey of college and university faculty to measure these and other topics. This is in collaboration with the Mary Christie Foundation, Boston University, and others. Next slide. One of the most important touch points that many students have right now with their campus is through faculty. I think about this every week when I log onto Zoom and see my students' faces, that I may be one of the only faculty or staff, or one of the only contacts that they have had with their campus that week. And I'm hearing a lot of reflections from students with a range of experiences in terms of how faculty are responding to this moment in time. But really, I think it's important for faculty to recognize the unique situation that students are in, that it's a changing situation. Many students have moved, they're in different living situations than they've been. Many of the risk factors that my colleagues mentioned earlier throughout this discussion. And so thinking about the opportunities for faculty to support students, whether that's creating space in class and other opportunities to connect and reflect, having flexibility with grading, assignments, course structure, getting student feedback along the way of how we can continue to adapt. And we're planning to collect data on this in our new national faculty survey as well. So really just highlighting the importance of faculty in this way. And I'm actually going to need to hop off because I've organized a virtual happy hour with the PhD students in my department, which is our second week going on this event. And it was a huge success last week, and I just don't want to be late for it. So Daniel's going to stay on to answer any questions for Healthy Minds, but I'm actually going to pop off. So thank you all and have a fantastic weekend. Yes.
Thank you so much.
Yeah, and just to close out our presentation, here's the contact information. We'd love to hear from you all if you have thoughts, questions, ideas for collecting data to help understand the situation better and help students more effectively. Thank you.
Thanks, Daniel. Thanks so much. So we do have some time left for questions. So I am going to, we've had quite a few come in. And some of you submitted questions in advance. I think the first question is probably a question for Becky, but feel free to the other presenters to give answers as well. So Becky, how do we keep students engaged without asking them to spend more time on the computer?
It's a great question. I wonder, without asking them to spend more time on the computer, it's interesting because yes, so much of our connection now has gone virtual and is computer or phone based. You know, we've seen different kinds of apps come up where it's like connect with a peer using an app that's delayed, so I can record my video message and send it to a friend, and then when they have time, they can send it back. So that allows us to be a little bit more flexible with the amount of time we're spending on screens, because we do know that screen time can be a challenge for some folks. And I think being very intentional with our screen use, you know, so if you are spending a lot of time doing classwork or anything on your computer, you know, we heard Nell say some folks that get outside for a little bit and disconnect. Don't continue the work on your phone while you're walking or being intentional with your physical activity. But then again, being intentional about how you do engage with those screens when the time arises. If anybody else has something to add to that, I'd welcome additional input. It's tricky. Life is very screen-based right now in terms of staying connected.
That's true. Did anyone else have any other advice there? That's a tough one. Okay, this is probably a question for Nell or Joy. How can we best prepare our faculty for the potentially large number of students who will experience grief-related death of loved ones?
This is Joy. So yeah, that's a great question. Again, I talked about the whole concept of grief, and I think there are obviously a lot of stages here of grief and people in different stages of that grief. But when there is a death of a loved one, clearly that individual needs to get support in however they can get that. And our faculty are gatekeepers. They are often the counseling center's eyes and ears, and they often have the opportunity to interact with students that sometimes the counseling center never does. So, I think providing gatekeeper training is so important, not just now when it's so needed in terms of identification of risk, but making sure that our faculty know the resources that are available on campus and in the community so that they can appropriately refer. We're never asking our faculty to be therapists or to take on a counseling role whatsoever. And we don't want them doing that. But what we do want them to do is validate the pain that the individual is in, the concern that is being expressed, the situation, be able to really show empathy related to that individual situation, and then appropriately refer them to the resources that are most appropriate. So, our faculty need to be up to date on what is happening related to the counseling center. Or have they gone to telemental health? Are they reaching out to students? What is the process in order to refer a student and get them engaged and hooked up with the right kinds of services related to the intensity of need?
So Robin, I would add another thing that's just another version of something I said, which is, the unique part of what we're going through now is that, sometimes we talk about an issue like this when students have lost a classmate and they're dealing with that loss. Here, faculty and staff will be undergoing their own losses. And so taking care of them and giving them the kind of care and support that they're going to need going through this time as well will then be something they can then give to others. I always think that, listening is an important skill, and that if someone has listened to you, you are then able to give that gift to somebody else. If you have not had that gift of someone listening deeply to you, it's much more difficult to even imagine what the next step must be. So I do think, because all of us will be involved in the tasks that Joy so nicely talked about at the beginning, it's going to be a very different kind of experience for all of us. I think as faculty, I think it's somewhat new to some of them who are basically content experts to think about holding the students in a way that's sort of comforting. It's, aids the anxiety relief. And I don't think they often don't think, if they're teaching physics or they're teaching something like that, that would not be something that would be on their radar for a task. But I was quite interested in the Healthy Minds emphasis on faculty, because I do realize now that I've switched over into faculty, and now that we're teaching our seminar on Zoom, how much now we need to think about those tasks.
Yeah, this is Nancy. I just also want to say, in terms of the role that faculty can play, especially now, and as someone aptly pointed out, faculty may be the only one, I think it was Sarah, the only one that that students are having contact with at their institution. When we work with schools and we talk with, as I mentioned earlier, everyone on campus has a role to play in promoting mental health. Yes, as Joy mentioned, we're not asking faculty, nor do we want untrained clinicians to take on a therapeutic role. But so many of our students can benefit from support. Not everybody needs psychotherapy. Now, I understand the question was about in response to grieving the loss of a loved one, which is a more obviously significant issue. But by and large, around faculty supporting students, number one, students usually revere their faculty more than anyone else on campus. And having your faculty member reach out, not and just when that light bulb goes off where looks like something's up with Nancy. She's usually talkative in class or whatever. I'm going to ask her, is everything okay? It looks like, you've been quiet lately. Unless I reveal something that's very significant, certainly we want the faculty member to know the resources and where to get me help. But 9 times out of 10, it's just that warm outreach, human being to human being, especially from faculty to student, that can go such a long way. And especially now, thinking about the limited contacts that students are having with anybody else on campus, a even much more important role for faculty to be playing right now.
Thank you. I think I had some audio problems, so I don't think I said this question so that everybody could hear it yet. But are there students, can someone speak to the experience of students, of marginalized students and the experience with them, and how we might be able to address their particular issues?
This is Joy. Let me take that one. So the question, if I understand it correctly, is related to how to reach out or how to help those students who feel marginalized in some way. And they might feel marginalized for a variety of reasons. It might be related to things related to culture, ethnicity, or et cetera, or it might mean that their perception is that they are not included, they don't feel like they matter. There's a lot that has been written related to the whole science of mattering, feeling like you are significant, feeling like you're important to someone else, feeling like there are other people in your camp, so to speak, that you have your people. And that's such an important concept, and not everybody has that. I know I do many sessions with patients, and one of the things that I ask in the intake process typically is, who are your support people? Who do you confide in? And I can't tell you how many times the answer I get is, I have no one. So that is so important that we figure out, I think, not only as therapists, but faculty, as staff, as caregivers, how to reach out and how to identify those at risk for whatever the reason, and be able to provide whatever kind of support might be indicated. So, again, I think it's just so important to be able to kind of have our antenna up related to who's in need. And it may not be very overtly displayed like what was explained. It could be very covert, but a change in behavior, a change in terms of responses. If you look at even social media kinds of behaviors, you'll notice often different patterns of behaviors that you just kind of identify, well, this could be kind of a red flag, but there's so many of those that we just need to really, I think all of us have our antenna up related to what the needs are currently of the people around us.
Thank you. This question is probably more for Nell. How do we turn off, since everyone's home and the computer's there and you're just working from home, how do you separate? Do you have suggestions for separating work and private time?
So, that checklist from the Institute for Healthcare Improvement, I thought was a good one. As you leave a place, that's for people leaving the hospital, but you're psychologically doing the same thing with time frames that some people do it what room they're in, some people do it with what clothing they're wearing, and change their clothes when they're out of the work thing. Some people do something at a particular time of day that says, oh, I'm shifting my focus at this one time. I think the thing, it's funny, I heard this from everyone, framework matters, and framework, having a frame and using that concept is very useful. Having activities that you only allow yourself, not during the workday, for example, so that you don't let yourself watch movies during the day or watch, that you think about a lunchtime, but it's a specific time, and you think about organization and structure during your day, and then perhaps more unstructured time at night. I think the space thing, all of us, now that we kind of realize we're not in a 2-week stay-at-home framework now, we may need to do a little bit more in reorganizing our physical spaces to do that. I think some of us, it looked initially like you were only going to have to get through an initial period of 2 or 3 weeks, but it's now clear that's going to be a little bit longer, so that the physical space may help us as well. Those are the kinds of things I think about.
So basically, the same suggestions that we gave for students apply to staff as well.
Yes, I think that's true.
Okay. Well, unfortunately, we're at the end of our time today. I just want to say thank you to all our presenters for their valuable insight. ACHA is taking a 1-week break from our weekly webinars, but we'll be back on April 17th. And in the meantime, please stay safe, be well. You'll be getting these slides and the recording. And thank you. Goodbye.